Welcome, everyone. Thank you for joining me this evening. My name is Nicholas Early, and we're going to be talking about meniscus tears, which is a really common injury that happens, and we'll go over a bunch of different things with that. So thank you for joining me. So just a couple things up front. Everyone is muted, so I can't, you won't be able to speak with me right now. Please, there's a place where you can type questions, comments, anything else you're having difficulty with. Let us know in the chat box. I'll go over some questions at the end as well. So anything you have questions about, just put in there, and then we'll get to those. And in addition, this is being recorded, so this will be posted up later on. You'll get an email link where you can look at the recording later on. So if there's something that you missed or you just want to review it again later, you'll be able to get to that. So I don't have anything to disclose in regards to this talk, or go over there. And just to kind of go over what we're going to speak about this evening, first thing we're going to do is just kind of review some general things about the structure and function of the knee joint, just so there's some baseline information there. We'll talk about the meniscus specifically, what it is, how it works, why it's important. Just kind of go over a few things. Many of you may have heard of the meniscus before, just because it is a really common thing to injure. And so a lot of people have either had one themselves or have had someone they know have had this or have encountered this through other ways. We'll talk about meniscus injuries, different types of injuries, and specifically the treatment options and how those things have changed and what more modern things there are to do for this and how our paradigm has shifted a little bit in terms of how we try to deal with these things. And then at the end, we'll go over some questions and answers. I'll answer some questions there as well. So a little bit about me. I'm an orthopedic surgeon. I'm board certified in general orthopedic surgery, but also have a subspecialty certification in sports medicine. Now, sports medicine, a lot of times people think that just means we're only dealing with people who are competitive athletes, but no, honestly, that means really dealing with a lot of different things. So yes, people who are competing in athletics, people who are just, exercising, doing, things for fun on their own. But also what sports medicine is really a better way of describing what our training involves is really arthroscopic surgery. So if you see that picture there on the left, that's a picture of the arthroscope, which is a camera with a light source that we put into the joint, where we can actually see in there using a minimally invasive approach. So we're really trying to, when we're doing any kind of procedures, we're trying to be as minimally invasive as we possibly can, aids in recovery. So that's a picture of what that looks like. And sometimes it's kind of hard to describe to people, but it's a pretty cool thing. A little bit more about me personally. I really do love sports and competition. I have a great wife and family. I have 3 kids who I love spending time with. I really enjoy the outdoors, all sorts of outdoor activities. And I'm really a little bit of a history buff as well. I like to read about history. And so it gives me something to do that's not related to orthopedics all the time. So I just want to kind of lay the groundwork here for things we're going to talk about. But just a couple of common scenarios that can occur that may sound like something that's familiar to some of you. So first of all, let's consider somebody who would be a 17-year-old male. Let's say he was playing soccer. He twists his knee and feels a pop. He may notice swelling, pain, difficulty with walking, maybe some other symptoms as well. And then let's take another patient, let's say a 63-year-old female. She's walking up the stairs, has a little bit of soreness maybe off and on, but then feels a pop in the back of her knee as she's going up or down the stairs, or maybe if she's doing yoga or something else along those lines. We'll kind of talk about these types of things a little bit more specifically, but just kind of keep those in mind as we go through this. So just a little bit about the knee. The knee is the largest joint in the body. There's really 3 bones involved in forming the knee joint. So the femur is a long bone in your thigh, and your tibia is your shin bone, and your patella is your kneecap. And those are the 3 bones that make that up. There's the bone itself. There's cartilage, which is the shiny stuff on the end of the bone, which is the bearing surface of the joint. There are ligaments, which connect the bones together. And then the synovium is the lining of the joint. So that's kind of, you can think about the innermost layer of a joint. And then there's a meniscus, which is the things we're going to be talking about tonight. And those are the little cushions. There's 2 in each knee, 1 in the inside, 1 in the outside. And those help with stability. We'll kind of talk about a little bit about that more here in terms of function. This picture here is if you're looking down on the tibia. So this is kind of a funny picture, but what I want you to notice is those 2 C-shaped things that are labeled as the meniscus, medial meniscus, lateral meniscus. I want you to notice that they're kind of funny shaped. They're like a funny shaped C. They're different in terms of the way they're shaped. Their size is different. Their kind of attachments placed are different. And because of that, they have a little bit different function. But you can see that they're kind of situated in the sides of the joint. And then there's a lot of different structures that are kind of around them as well. So what is happening in the knee joint? What's the meniscus doing? Well, the meniscus is really helping with load bearing. It's a shock absorber, so when you're putting weight on your knee, it's distributing forces through the knee to kind of help space things out so there's not too much any contact in one area of the knee joint. It also has some lubricating properties as well. It can help with lubrication of the joint, which also helps with motion and keeping friction low in the joint. There's a sense called proprioception in our body, which is basically kind of knowing where our body is in space. And so it helps with that, which kind of helps with feeling like your knee is stable to you. And then also it is a stabilizer of the knee too. Now that's somewhat secondarily. So ligaments are the things that I mentioned hold bones together. But the meniscus kind of also has some stabilizing effect as well, just because it kind of helps to secondarily keep the knee from sliding around too much. This is another picture which is trying to just illustrate the function of the meniscus. So it's kind of a funny looking picture. What you're seeing there are lines going in different directions. And this is like a cross section or kind of a cuts of the meniscus in different places. What you notice is that there are these different lines and fibers kind of going in different directions. What that's illustrating is that there's kind of this very important architecture to the meniscus, which helps with its function. So it helps to distribute forces in specific ways. And if that architecture is disrupted, it can cause a major issue. So it is a pretty interesting structure just because you have to kind of take into account, some of these different fiber directions and stuff when you're thinking about the function of it. And we'll get to this in a little bit, but when you're talking about repairing it as well. The other thing about the meniscus is that it is a very dynamic structure. So when the knee moves, the meniscus moves. And more so with the meniscus in the outside of your knee, called your lateral meniscus, but the inside meniscus too, the medial meniscus. And this is also very important for function, but it also can be one of the reasons why there is an association with injuries as well with certain types of motion. From a biological standpoint, when you're talking about the meniscus, there's a couple of things that are important to understand if you're looking at, what happens and why it heals in certain ways and why it doesn't heal. So only the very outer part of the meniscus towards the edge of the joint has a good blood supply. So this picture on the bottom right there, all the little black lines there are actually blood vessels, which have like a dye in them. And then this is kind of a cross section of that. And the structure that's labeled meniscus there is kind of the innermost part of the meniscus. And you can see there's not really, all these little blood vessels going to that area. That's indicating that most of the meniscus doesn't have a blood supply. And so what happens is you injure the meniscus in that area, you end up with a situation where there's not a good blood supply for healing. So it can be more difficult for things to heal. Blood supply is really important for healing. So when we're talking about the meniscus, we'll oftentimes use terms like you're seeing there listed in terms of the part of the meniscus and what its vascularity is. But really the important thing to consider here is that the meniscus can't always heal, and it oftentimes doesn't heal on its own. So meniscus tears or injury to the meniscus is extremely common. If you look at the numbers, there's about 750,000 arthroscopic knee surgeries performed in the United States each year. And obviously that varies somewhat, but not all of those are for meniscus tears, but a large portion of them are. If you look at the numbers on that, and some of these numbers are a little bit older, a few years older at this point, there's more males than females, but I would say anecdotally, certainly in my practice, I see almost even numbers there. If you look at the age in terms of the meniscus tears as well, you see a little bit of an age difference in terms of which meniscus is injured. And that just has to do with how the injuries occur. Oftentimes injures, each meniscus differently. About a third of meniscus injuries are associated with sports, but that means that 2/3 of them aren't. So as I was mentioning in the beginning, in sports medicine, we oftentimes, kind of make people often think that we're dealing with just, professional athletes or, people who are competing in some high level activity, but really it can be just doing everyday things. You could just be picking up laundry and twist the wrong way and tear a meniscus. So it's not something that necessarily, is always going to happen with athletic activities. So when we're looking at the meniscus in terms of how it can get injured, there are different directions in which it can tear. So we use this to kind of describe where that's tearing. And this goes back to that picture that I showed that had the lines going in the different direction with the meniscus, showing the different directions of the fibers. So if you tear along the outer edge of the meniscus, it can flip in a certain way. If you tear it in another way, it can be called a radial tear, where you're kind of tearing in one way. So there's different types of tearing, and that just has to do kind of with the direction of which those fibers are disrupted. And that varies depending on how the meniscus is injured, but it also has some bearing on how you can fix it as well. So first off, when we're talking about treating and fixing meniscus tears, there's something important is that not all meniscus tears will need surgery. So in some, there'll be spontaneous healing if the meniscus tear is less than 1 centimeter and it's a vertical tear, which means that it's going to tear along with the fibers and usually in an area where there's a good blood supply. If it's less than 50% thickness of the meniscus, if it's a small radial tear, less than 3 millimeters, meaning it's usually just the very edge of the meniscus, that also can stabilize and not require surgery. So those are ones, oftentimes it will encounter them even if you're doing a surgery for something else, you may see it and it may not require anything significantly. Now, on a different note, outside of injuries, there are changes that can happen in the meniscus as we age. And those degenerative changes, so just, think about aging as a process of, your entire body is aging. So as your hair gets gray, all the other tissues in your body start to get a little bit less pliable than they were, as you can start to get some degenerative changes to your meniscus and other structures. And it's not uncommon for people to start to get degenerative tears in their meniscus. As that happens, sometimes those are very symptomatic and sometimes they're not. With degenerative tears, certainly non-operative treatment can be effective. And so oftentimes we'll try that. Now, what does that look like? Oftentimes, we kind of go through the basics, RICE, which is, rest, ice, compression, elevation, just basic things to help with pain and inflammation. Physical therapy is a mainstay for treatment for those types of injuries. Anti-inflammatory medications, if somebody's able to take them, can help with pain and inflammation. And sometimes also we're looking at injections, oftentimes to help with symptoms, because if somebody has a degenerative meniscus tear, oftentimes they have some arthritis in their knee as well. And so there's some things that we can do to help with those symptoms. Now, we'll go through a couple things here in terms of some repair techniques. We'll talk a little bit about the different types of tears that we kind of just touched on briefly and why those techniques are a little bit different for those different types of tears. And just touch on a couple other things like meniscus transplant, the idea of replacements, biologics. We'll just touch on a couple things here. So first thing, what is the most common surgery that's performed on a meniscus by far in the United States is a partial meniscectomy. So what that means is somebody has a tear in their meniscus. You go in there with a camera, as we're talking, working with instruments, in the knee to basically remove the torn fragments of the meniscus. Now, historically, this is, what you did for most meniscus tears. As our techniques and technology have improved, we try to, do this less. But the indications for this are basically degenerative tears where the tissue is not going to heal. If it's a tear in the avascular region where there's also low chance of it healing with any kind of repair. If it's unstable in a way that you can't repair it to be stable, or there are just some tear patterns like this picture here on the right where all that kind of crab meat looking stuff is basically just shredded meniscus. And so you basically just have to kind of get that, destroyed tissue out of there because it can get caught in the joint. It can cause pain, swelling, and all the other symptoms that you may be associated with a meniscus tear. Now that said, partial meniscectomy is not a completely benign thing. there's a pretty common correlation that we see with development of osteoarthritis long-term after somebody's had a meniscus tear and has had a partial meniscectomy. If somebody has cartilage damage along with this, which is very often the case, then there's an even increased risk of this. If you have a partial meniscectomy and you have a trimming of the meniscus, that doesn't necessarily improve your chances of not developing arthritis. So it helps with the symptoms of the meniscus, but it doesn't improve the contact forces. You're not restoring the function of the meniscus from the tear. You're just kind of improving the symptoms associated with the tear. Now, unfortunately, this is a large portion of meniscus tears. I personally have had this kind of type of surgery. And so it is oftentimes the case when somebody does have a meniscus tear, you have to do this. But that said, with some, like I said, some innovations and stuff like that, we're trying to, trying to repair as many meniscus as we can. So what does that look like? Well, now I'll kind of touch on a couple different repair techniques in terms of the meniscus itself. It really kind of depends on what the tear pattern is. So for instance, if somebody has that longitudinal tear, which you kind of see in the top right there, that line that's going along the edge of the meniscus, those tears, you can oftentimes kind of sew back to where they're torn or disconnected. And there's a couple different ways to do that. One of them is what we call inside out, where you're basically passing stitches from the inside of the knee to a small incision on the outside of the knee, and then we tie those down and repair the meniscus back to where it is attached. And that can be pretty effective for certain types of tears. That's been around for a long time. So that's kind of the gold standard for this type of repair. I still do this regularly. Just depending on the type of tear, it's a little bit more involved, but some tears require. So that's just kind of something we still do all the time. Outside in is another way. So in certain locations, instead of having to pass a suture from inside out in those needles, we're actually, kind of doing it the opposite direction, but it's kind of the similar type of mechanism, similar type of repair. It's just a kind of a different set of instruments and a different direction. Then there are some other newer things. So there's something called a horizontal cleavage tear, which is basically where the meniscus tears horizontally. And so you have this split. Now, historically, the only thing people would do with these is pretty much try to remove the part of the meniscus which is torn in the bottom. And the reason being is because it's really hard to pass suture through the meniscus that's going to capture both sides where it's torn in this direction. So there's been a lot of development over the last, really even 5 to 10 years in terms of devices that have allowed us to pass suture around the meniscus. And so this allows for some compression of the meniscus. It allows it to potentially heal such that you don't have to remove meniscal tissue. So that's really been a game changer. There's been a lot of good evidence that suggests that it restores the contact pressure. And so you're actually improving the chances that you're going to avoid arthritis, or at least decrease the risk of arthritis, long term, which is really important, especially when you're talking about, if you can imagine you're injured or this happens, when somebody would be a teenager and it's like, hey, you trim out that meniscus and then you're looking at potentially having arthritis by the time you're, in your 30s. This is just a couple, things that demonstrate what I was just talking about, which is essentially those suture passing devices. There's a couple different ones that are out there that we use, and it has really allowed us to do some really cool things that we couldn't do, until relatively recently. And it's kind of changed the dynamics a little bit in terms of how aggressive we are with trying to repair the meniscus. So here's a case I did recently where this was a really complex meniscus tear. There was some shredded flap tissue, but then there was a horizontal component to it. And so what I did is I passed a couple sutures around the meniscus, tied them just to cinch that up so we didn't have to remove as much meniscus, basically, to try to restore as much as possible and save, about 75% of the meniscus or so, as opposed to getting rid of over half of it. Now, this is back to our patient that I was talking about at the beginning. So think about that 17-year-old playing soccer, twists his knee, feels a pop, and all of a sudden we're looking in the knee in surgery. We know let's say that we had an MRI, we know there's a meniscus tear, and boom, you get in there, and what we see is what's called a bucket handle tear. So that's where the meniscus tears in such a way that a large piece of the meniscus can flip like a bucket handle over on itself. And so what you do in this situation is you kind of try to get this repaired because it's a large portion of the meniscus. You really don't want to trim that out if you don't have to. Try to save as much as you can. So you kind of clean up the meniscus, get it pushed back where it needs to be, that's kind of on the left there, we're kind of looking right down the edge of the meniscus. You can see that tear. The metal thing in the middle there is a probe that's just kind of pushing it back where it needs to go. Oftentimes, as you see the picture on the right, what the metal thing is pointing at is actually some cartilage damage. So even in a short period of time, if you don't have a functioning meniscus, you can start to get damage to the cartilage on the end of the bone as well. And so that could be a big problem, clinically as well. So that's something to take into account, but that's one of the reasons why we want to repair the meniscus. So then what you look at is you're using, oftentimes in a meniscus repair case, it's not just using one technique. It can be a combination. So you can use some devices which allow us to pass sutures and fix the meniscus all inside, and then some inside out, and then even outside in on the right picture as well. So you're kind of combining these techniques to do a good job. And then afterward, you have a good repair there of the meniscus. And then sometimes we'll do some additional things, which you may even hear about, something like microfracture, which means, stimulating some bone marrow elements to help with healing. And that's a whole, additional thing to talk about here. Another really important type of meniscus tear to know about is the meniscus root. So the key word there in that is the root tear. The root is the operative word, because it basically means that when the meniscus is torn, the meniscus is losing its function because it doesn't have its attachment anymore in the back of the meniscus. These can be associated with a trauma, but oftentimes they can be degenerative when there doesn't have to be a big injury associated with it. So when you don't have that meniscus attached in the back, you're basically losing the function of the meniscus completely. So it's essentially like not having a meniscus. And there's great contact pressures on the knee joint. And so there's a high likelihood of developing arthritis relatively quickly with a meniscus root tear. So what we do for these, and this is kind of going back to like our first patient, but basically the second patient that we were talking about, what you're trying to do here is to restore that meniscus root attachment. So you're basically passing sutures through the meniscus in the back, but then we use a little drill tunnel to pass those sutures down and tie it back down to the bone. So the key there is we have to reattach that root back down to the bone so the meniscus can have its function again. And unfortunately, these are very common. And really, I would say that in terms of root repairs have become a lot more common in the last, 10 years or so. Prior to that, though, this was not as common just because the techniques have really improved our ability to pass suture and do some of the things that we can do now. So here's an example of that. We're on the right. You can see the suture that's kind of passed around the meniscus, pulling that down into a tunnel, which is reattaching that meniscus back down to the bone. And that's restoring the function of the meniscus. The hope here, when you're doing a meniscus root repair is to restore the function of the meniscus, improve their pain greatly, but also help to slow down arthritis. And there's been good data that suggests that if you do meniscus root repair, you significantly slow down the chance of arthritis, slow down the chance of somebody needing something like a knee replacement. Other things in terms of meniscus treatments, so there's other things that we oftentimes do and people will hear about. So I often get asked about PRP, which is platelet-rich plasma. That's a biologic where you're actually taking blood out of the patient. You spin it in a specialized centrifuge to isolate some of the plasma that has platelets in it. It has a lot of growth factors. If you look at the results on that, doing it for a meniscus tear alone doesn't really have great indications. There are good indications to use it for arthritis. Now, as an adjunct along with meniscus repair, there's some evidence that it may have, some improvement, but it's really kind of mixed. If you're looking at something, oftentimes I'll get asked about stem cells as well. Now, I'll tell you, and this is a separate talk that I'll have to do sometime, but basically when you're talking about stem cells and the use and the things that we're using now, what we call stem cells, really a better term is mesenchymal signaling cells. And the reason being is because they don't really have the capacity to change as much as like a real stem cell would, but it is something that can be very useful to help with arthritis symptoms. Once again, kind of mixed data with how much this helps, not really showing too much improvement with the meniscus repair if you're just doing injections alone, but potentially with surgery can improve the healing. More on that in the future, just based on research that has to be done. So that's not something that is really well ironed out yet from a scientific standpoint, but I would not be surprised in the future if biologics play a bigger role in terms of meniscus treatments. Sometimes people ask about replacing the meniscus. Now, there are some devices that are out there that are really kind of in trial use, not really widely used yet. This guy on the right here is Dr. Christopher Kading. He's at Ohio State. He's my fellowship director when I was there years ago. And he was involved in actually the first implant of this device, which was under FDA study at the time. And basically it was a meniscus replacement type of device. So if somebody lost their entire meniscus, you might put this in there. Same thing there. So replacement devices, scaffolds, there's a lot of research getting put into that. It's still very much in the infancy in terms of development. And then meniscus transplant. So this is actually a procedure that has been around for a while. There's pretty good data on it, so we know what to expect from it. And somebody who does not have a meniscus because of injury, and let's say they had to lose a lot of it, during a surgery or something along those lines, they have isolated pain in that area. They have a pretty good joint otherwise, or their cartilage can be restored at the same time, and their knee is stable. It's something that can improve symptoms, but it's not a first-line treatment because it's really not something that's going to restore somebody to their norm. It's kind of a bailout thing in a lot of situations. It's difficult for people to get back to things like sports, but it can be an option in certain situations that we do. So lastly, just to talk about some really important things, the rehab is really important for meniscus repairs. Early on, oftentimes we get people restrictions using crutches, and this is really important to help with healing of the meniscus because that meniscus has to heal in order for the repair to be helpful. If it doesn't heal, even you can do the best repair in the world, it won't last. It'll fall apart again, and so you'll basically have gone through that for nothing. So it's really important to allow for the healing. But then early on, we focus on getting range of motion, working on strengthening, and then eventually, as things progress, getting back to functional rehab and getting people doing the things they want to do. So with that, we can get to questions now. If you have anything else you want to ask, go ahead and just put that in the chat box. You have our information there for contact. I'm going to go ahead and click on this, and then we'll start doing some questions. Okay. So here's a good question that I often get asked, which is, here's somebody saying that they are active, they never had knee problems. What can they do to keep it that way? So there's a couple things to touch on there. So one is that there's a lot of things that contribute to why people do have knee issues. Age is certainly one, but genetics is another. So actually people who can just be predisposed to get arthritis, trauma you had when you were younger, some other things. So there's a lot of things that kind of can get there that you can't really change. Now, in terms of, what to do, being active and actually keeping yourself moving is a good thing for your joints. There's some evidence that suggests that even like light resistance exercises and certainly, things like riding a bike and, even running potentially is good for your joints. If you have significant damage or any kind of injuries to your joints, oftentimes running can exacerbate symptoms. But in terms of trying to keep things in shape, in terms of your cartilage and your meniscus and all these tissues, it's really hard to say that there's one thing you can do. I would say in general, keeping your health as good as you can, certainly trying to keep your weight at a manageable level can be helpful. There's not really any evidence that suggests that taking certain supplements will help necessarily prevent joint problems. Sometimes they can help with the symptoms. And there's a few things that can, are in that category, but even the data on that is mixed. So really the best thing you can do to keep yourself, healthy is really just to, your knees healthy is just to kind of, try to avoid injuries and keep yourself in good shape overall. Somebody else asked the same thing. Are there any specific exercises to prevent this? And that's a good question. So honestly, there's nothing specific to meniscus tears in terms of exercises, but depending on your activities, there may be something to consider there. So for instance, if you like to ski, you may want to make sure that you're really keeping yourself active. You're working on all your stabilizing muscles, and specifically those are a lot sometimes your quads, your hamstrings, and your hip abductor muscles, and doing a lot of functional exercises so that if you are doing some kind of, cutting, pivoting activity or just being, more active or something, that you're less likely to get a tear or have an injury. Somebody else then asked in a kind of a different way, are there any motions that are higher risk? And there's definitely something, some things that are associated with that. So if you look at what types of loads and motions are oftentimes associated with meniscus tear specifically. So there's a couple of different categories there. If you're looking at being in a loaded flexed position, which is often something like squatting and twisting. So oftentimes we'll see people with a meniscus tear where they're bending down and they twist their knee. Other things would be something like an ACL type of injury. So if somebody is in a cutting and pivoting type of activity, the twisting motion can also be associated with meniscus. If somebody has a degenerative meniscus, and we do see this quite often, it doesn't even have to be something very severe to cause an injury. So like I said, and I described that second patient in the beginning was, they could have been just walking up and down the stairs, doing yoga, something where it's like, kind of low impact. And sometimes it doesn't take much just to push it over the top. Let's see here. Where's the fine line between rehabbing a meniscus and surgery? So it kind of depends on a lot of different factors. It depends on the patient. It depends on the meniscus tear itself. It depends on the condition of their knee overall. And, is there a capacity between, for that to heal? If it's a tear that surgery, you're not actually going to be repairing something. Let's say the only thing you can do is a partial meniscectomy, then you might be a little bit more, likely to try rehab first, because if it fails, you're not really necessarily losing anything in terms of the function of the meniscus being restored. However, if it's a tear where you can repair the meniscus, sometimes we're more aggressive there because we can actually decrease the risk of somebody getting arthritis and having further problems in their knee. Good question here is, can the meniscus grow back on its own? And so if somebody has a partial meniscectomy, no. If it tears, and I kind of mentioned this earlier, small tears, so ones that are less than a centimeter in a stable part of the knee, can heal and kind of scar. But, in terms of regenerating tissue, the way that you would a bone, so for instance, if you break a bone, like you break your collarbone, it can heal even if it's pretty significantly displaced. If you tear a meniscus, unless it's one of those small stable ones, it's usually not going to heal. And if you tear it and you have to have surgery on it, you're not going to get that meniscus tissue back. Somebody asked here, are meniscus injuries or other knee injuries hereditary? Well, as I mentioned, there are some factors that contribute to that. So definitely we see that there's a correlation between arthritis in different families. Meniscus tears themselves, not directly that I really know of, but oftentimes the two are associated. So meniscus tears and arthritis in those situations. So this is a good question that we have to deal with all the time, which is, can an athlete perform and put off meniscus tear through the season? So once again, depends on the type of tear, depends on the person, what their activity is, what their symptoms are like. So for instance, if somebody had a large bucket handle meniscus tear, there's no way to put that off. That's something that you're just going to have to deal with. Even if it feels okay for a while, it could flip into a bad position at any time, and then then you're kind of back on crutches. And and every time that happens, it's less and less likely that you could heal it. So if somebody is an athlete, they have a tear that's that bad, we're just telling them, no, we got to fix this now. Now, that said, let's say somebody has a small tear in their meniscus, and if it would require surgery, it would only require a partial meniscectomy, and their symptoms are relatively minor, then sometimes people will try to compete. It really just depends on the situation. Now, here's a good question, and I can sympathize with this just based on my own personal experience. As I mentioned before, I had most of my meniscus removed in my 20s. What options do I have to prevent further pain and wear and tear? And will I need a knee replacement? So it kind of depends. So depending on what the condition of your knee is now, some of those things that I mentioned before, can be options to help with symptoms. If you don't have much of your meniscus and you have no cartilage damage, your knee is otherwise in good shape, but you're having pain, that's where something like the meniscus transplant can be helpful. I would say it's relatively rare. Those are not the most common, situations. Most of the time, if somebody has had a meniscus tear years ago, oftentimes they do start to develop arthritis. There are a lot of things we do to help mitigate that and help with the symptoms. And sometimes there are surgeries that we'll do if people develop significant arthritis. The treatment for that is always evolving as well, but sometimes that does, end up in something like a knee replacement. But it really is somewhat of an individualized situation. Another question here is PRP typically covered by insurance? Now, interestingly, for most joint conditions like arthritis or a meniscus tear, it's not. There are certain things where it is sometimes, and it depends on the plan. So like for instance, for tennis elbow, we use it a lot because it can be really helpful for that. And there's really good evidence that suggests it works really well. And oftentimes we can get some coverage for that. For something like a meniscus tear or arthritis, a lot of times it's not. Somebody asked here just what types of activities, if any, are the leading cause of meniscus injuries. As I mentioned before, cutting, pivoting activities. I see a lot of injuries just doing everyday activities, like, somebody could be raking the leaves and step in a hole and boom, they tear the meniscus. Or whatever it is. So freak things all the time. And then also, like I mentioned before, squatting activities or anything when you're bending and loading the knee. So we'll see those as well. Somebody asked, this question is a great question too. As an athlete or doing something, active, do you recommend wearing a brace or any kind of support? So there's nothing to suggest that any kind of brace or anything would prevent a meniscus tear. There's no evidence of that. There are only a couple different situations in which braces would help prevent ligament injuries if there's ever really been proven. They can help with the symptoms associated with knee issues. So sometimes using something like an elastic support or something along those lines can really help people's knees feel better, but not necessarily, really prevent an injury. So oftentimes, as I mentioned, keeping yourself in good shape, keep your weight under control, keeping yourself warm up before you're doing any activities as well, just so you're moving well. And then, obviously just taking care of yourself otherwise will help, do the best you can to prevent injuries. All right, I think that's most of our questions. So this will, like I said, this will be available recorded. So if you want to check back with anything, just let us know. I'm happy to see anybody, anytime to discuss this stuff further. You have our contact information there, and I hope you all enjoyed it. And, see some of you in the future.